one cerebral hemisphere will coordinate the movements of another hemibody, because we have the decussation of the pyramidal tract, and this decussation it's related to the inferior aspect of the medulla oblongata pyramids. This is important to know. This is the main the main gross anatomy of the encephalon. Here is an axial cut of the midbrain of the mesencephalon. As I said, the anterior aspect is called the cerebral peduncle, and then the intermediate one is called the tegmentum, and then posteriorly we have the tectum. What I want to pay attention here is how one brainstem will subdivide it into two diencephalons and then two cerebral hemispheres. And this division is made by the presence of these two cerebral peduncles. So understand that we have just one brainstem. So we have just one medulla oblongata, one diencephalon, one medulla oblongata, one pons, and one mesencephalon. But then the mesencephalon, it has two cerebral peduncles. And because of these two cerebral peduncles, superior to the mesencephalon, we have paired structures. So we have two thalami, we have two cerebral hemispheres, just because of this relation. And then I always put this image here for you guys to see this image, how one brainstem will subdivide it into two. I like this notion of the central core, but the central core is really an enlargement of the concept of the diencephalon. Understand that superior to the mesencephalon, we have two diencephalon. Diencephalon is the thalamus itself and everything that's related to the thalamus. So epithalamus, metathalamus, and hypothalamus, this is all diencephalon. And the thalamus itself, that's called the dorsal thalamus or the proper thalamus. This is the thalamus itself. Everything that's related to the thalamus word is the diencephalon. And the central core is one enlargement of this concept. This is another view that I like to show that how inside each cerebral hemisphere we have one central core. One central core is just a block of structures. If we make a cut of these structures, we can see this formation of this block of alternating layers of gray matter and white matter. They are alternating themselves. This is an axial cut of the central core, and we can see alternating gray matter and white matter. If you come outside in, we have the insular cortex, extreme capsule, claustrum, external capsule, lentiform nucleus that is indeed made by two separate nuclei, the putamen laterally and the globus pallidus medially, but because of them together having this lens appearance, they have been named as the lenticular nucleus. Then medial to the lenticular nucleus, we have the internal capsule. Medial to the internal capsule, we'll have anteriorly the head of the caudine nucleus and posteriorly the thalamus. So just the thalamus here is really a diencephalic structure. All of these are basal ganglia intermingled with the capsules, the white matter capsules, and then laterally we have the insula that's already telencephalon. So some people will not like this view of the central core because we are putting together structures with different origins, with different functions, but morphologically it makes sense because everything here is together. So we also like this view to understand how the brain is formed, putting the central core in the middle, and then orbitating the central core, we have the lobes. We have the frontal lobe anteriorly, we have the parietal lobe superiorly, occipital lobe posteriorly, and the temporal lobe inferiorly. Then we have the fifth lobe of the telencephalon, that's the insular lobe at the lateral aspect, and making these two C's around the thalamus, we have the limbic lobe. The limbic lobe is called the limbic because it's going around. It's called limbic because it is around. It is at the limbus, it is around. And that's why it's making these C's. So we have an inner C made by the amygdala, the hippocampus, and the fornix. This is the inner C or the subcortical C of the limbic lobe. Inside we have the thalamus, of course. And then we have the outer C. We'll come to this later, but we have the cingulate gyrus and the parahippocampal gyrus. This is an outer C. Here is the brain itself, subdivided by the forks into these two cerebral hemispheres. And we have the hemispheres, and they are really detached from each other. The only structures that are connecting both cerebral hemispheres are the commissural fibers. The most important commissural fibers of the mammals, including us, of course, is the corpus callosum. But we have other commissures that are not really that important functionally for ourselves anymore. For example, anterior commissure, posterior commissure, limbic commissure. These commissures can be cut by the neurosurgeon without having any major neuropsychological interference for the patient. But of course, you cannot cut all the corpus callosum. So understand the cerebral hemispheres up to a point really separated between themselves, but just connected by the corpus callosum. This is the major commissural fiber pathway of the brain. And then each cerebral hemisphere, how we will divide each cerebral hemisphere. So Louis-Pierre Gratiolet came with this idea of subdividing the cerebral hemisphere into different lobes. So he put 5 different lobes. This is an anatomical idea, but in fact, the cerebral gyri, they continue between themselves. There is not a natural subdivision between the different cerebral lobes. So in the beginning, he took advantage of the natural separation between the bones of the skull, and he related the separation of the bones to the separation of the cerebral hemisphere, the cerebral lobes. Of course, we didn't know much about the brain anatomy at that time, but at that time we already knew about the bones. So we were using the sutures, the cranial sutures, to divide the brain itself. And then we began to understand more about the brain surface, and we stopped using the cranial sutures to divide the brain in its lobes, and we started to using brain anatomic landmarks to divide the brain in its different lobes. And nowadays we come to a system that most schools will use. So first of all, we're going to look for the lateral sulcus of the brain, also called the Sylvian fissure. The Sylvian fissure is dividing a space superiorly made by the frontal lobe and the parietal lobe from a space inferiorly made by the temporal lobe. And underneath the Sylvian fissure, we'll have inside the Sylvian fissure, really deep to the Sylvian fissure, we have the insula. Another major anatomic landmark is the central sulcus. The central sulcus is separated from it can be seen differently from the other cerebral lobes by 3 main anatomical aspects. First, it is oblique sulcus. It's almost vertical. We called it oblique because it's a little bit folding backwards. So it's called oblique. It's also one isolated sulcus, meaning that it usually does not receive important sulci anteriorly or posteriorly. It's really isolated inside this part of brain here. And it's also a continuous sulcus. This is another concept. The sulcus can be interrupted. For example, the inferior frontal sulcus and the inferior temporal sulcus, they are usually very interrupted, but not the central sulcus. So if we go by these 3 rules, so it's oblique, it's isolated, and it's continuous, it's easy to see where the central sulcus is. And because every one of us, every human being will have a central sulcus, it is used as a cerebral landmark to divide the frontal lobe anteriorly from the parietal lobe posteriorly. And now we're going to trace an imaginary line coming from this aspect, this bulging aspect of the inferior margin of the brain. Is called the preoccipital incisure or preoccipital notch. It's a nice name because it's preoccipital. It's just in front of the occipital lobe. So that's called preoccipital notch or preoccipital incisure. And we'll draw this line beginning at the higher aspect of this notch to the parietal occipital fissure, not really seen in the lateral aspect of the brain, but really easily seen on the medial aspect of the brain. We're going to show it later. So putting together the preoccipital notch to the parietal occipital fissure, we will draw this line. Posterior to this line, we have the occipital lobe, and then anterior to this line, we will connect the midpoint of this line to the inferior to the posterior aspect of the sylvian fissure. We have the parietal lobe superiorly and the temporal lobe inferiorly. So here we have the 5 lobes of the lateral aspect of the brain. We have the frontal lobe, parietal lobe, occipital lobe, temporal lobe, and insular lobe. But the brain has 6 lobes. Where is the 6th lobe? The 6th lobe was described by Paulo about 150 years ago. He noticed that some structures are made in this round, this ring around the thalamus. And then he put this idea of a limbic convolution, meaning around the thalamus. And as you can see, the cingulate gyrus that is just lying over the corpus callosum, it's called the cingulate gyrus. It has it gets smaller posterior to the splenium. It's called the isthmus of the cingulate gyrus, and it continues itself with the parahippocampal gyrus. The parahippocampal gyrus harbors the hippocampus, and that's why it's called the parahippocampus. It is formed along the hippocampus, and that's why it has its name, parahippocampal gyrus. If you put the parahippocampus, isthmus, and cingulate gyrus, it forms the C. It's called the outer C or the cortical C of the limbic system. Then inside the parahippocampal gyrus, we have the amygdala anteriorly and the hippocampus posteriorly, and the hippocampus continues posteriorly with the fornix. The fornix is really the outside output, is the efferent fibers of the hippocampus. So the information of the hippocampus continues with the fornix, and the fornix continues medially and inferiorly with the mammillary body. And this is also a C. This is called the inner C or the subcortical C of the limbic lobe. This anatomy, surface anatomy, has been revised by many neurosurgeons, because the more recent, the more updated neurosurgery is done by is made a lot by the natural corridors of the brain. And to enlarge these corridors, we have to use microdissection techniques. So we use the microscope, we use very fine tools, fine instruments to get inside the sulci and the fissures of the brain. Of course, we will have to deal with the vessels. Arteries and veins are inside these natural spaces of the brain. But if we do this with precision, with microsurgical techniques, we can really unfold the brain. We can get inside the natural corridors and up to a point reach a lot of cisterns, spaces inside the brain, even the basal cisterns, for example, and a lot of lesions are not really inside the brain. For example, metastases, meningiomas, craniopharyngiomas, vascular lesions. They are just inside these natural spaces of the brain and can be reached without going through the brain, just the neurosurgeon navigating the natural spaces of the brain. Inside this big subject that's called the surface of the brain, we made a lot of studies regarding the cranial-sulcal relationship. We came up with these key points. That's really a set of key points that we can understand how the skull is related to the main sulci. This is a big paper that we published with Professor Ribas, my father, Guilherme Ribas, also a Brazilian neurosurgeon, and a group of other researchers as well. And you can look this at the Neurosurgery journal, and we put together all these relationships. If you want to place your craniotomy related to a given sulcus, if you want to really if you don't have all this technology, for example, neuronavigation, we use these craniometric key points. This really helping us. It's some landmarks that is gonna make it easier. So now at the second part of our talk, I want to show for you guys each blueprint of each cerebral surface. So we have 3 cerebral surfaces. We have a lateral surface, also called the superlateral surface because it's making this round turn superiorly, or convexity of the brain, 3 names for the same surface, so lateral, superlateral, or convexity of the brain. There we have a medial aspect of the brain, medial surface of the brain, and we have one inferior or basal surface of the brain. Let's see the blueprint, how each surface is organized. The main structure, the main anatomical landmark about of the lateral surface of the brain is, of course, the Sylvian fissure, dividing frontal and parietal lobe superiorly from the temporal lobe inferiorly. But don't understand the Sylvian fissure just as this lateral aspect. Understand the Sylvian fissure also with this ventral aspect, or what has been called the stem of the Sylvian fissure. This is the brain seen anteriorly, and we can the temporal lobe inferiorly. This is the stem of the Sylvian fissure. This is a magnified view of the stem of the Sylvian fissure. Here is where the first segment of the MCA, the middle cerebral artery, is going through. So M1, it goes from the origin to the limb and insula. This is where M1 would be. And then the second division, M2 already over the insula, M3 over the opercula, and then M4 already at the lateral aspect of the brain. This is the major corridor of the neurosurgeon, splitting the Sylvian fissure to get deep inside the brain, to reach the basal systems, and to treat pathologies that can be at that site. This is a notebook, almost 100-year-old book, and it has this notion of lack of consistency. If we see all the brains, even our right side to the left side, it will be different between everybody. And these differences we have to consider in our plan, is in our blueprint of the brain. So, for example, here is the inferior frontal gyrus. The inferior frontal gyrus is subdivided into 3 parts. The most anterior one is called the orbitalis, the pars orbitalis. The intermediate one is called the pars triangularis, and the posterior one is called the pars opercularis because it's already over the insula. That's why it's called opercularis. And it's really the connection of the inferior frontal gyrus to the precentral gyrus. So see here the subject in the middle. Where would be the pars triangularis? Perhaps here. And the subject on the right side, pars triangularis, perhaps here, really far away from the Sylvian fissure. So you can see this lack of consistency. It's very common to see this lack of consistency. But all brains will follow up to a point blueprint. So I'm trying to make it short phrases for you to remember this blueprint. So first, see the lateral aspect of the brain and look for 3 poles. We have a frontal pole, a temporal pole, and one occipital pole. At each of these 3 cerebral poles, we'll have a merging of 3 cerebral gyri. So 3 frontal gyri will merge at the frontal pole, 3 occipital gyri will merge at the occipital pole, and 3 temporal gyri will merge at the temporal pole. So 3 poles, 3 gyri for each given pole, and the names of these gyri are really easy: superior, middle, and inferior one. Then we have an ellipse. An ellipse in the middle of the lateral aspect of the brain is formed anteriorly by the precentral gyrus and posteriorly by the postcentral gyrus. And as I said, the central sulcus is in the middle, and it's really an uninterrupted sulcus. And because because of this being uninterrupted continuous sulcus, it makes the gyri anteriorly and posteriorly will make this ellipse. So some people will also call this the central lobe of the brain. And then the parietal lobe, posteriorly, divided by an anterior to posterior sulcus called the intraparietal sulcus. Intraparietal sulcus is a nice name because it's inside the parietal lobe. So intraparietal sulcus. Superior to the intraparietal sulcus, we have a quadrangular piece of brain. It's called the superior parietal lobule. And then inferior, we have 2 arched gyri that together will constitute the inferior parietal lobule. The anterior arched gyrus is called the supramarginal gyrus because it's over the posterior margin of the Sylvian fissure. This is why it's called the supramarginal, over the posterior margin of the Sylvian fissure. And then Posteriorly, we have another arched gyrus called the angular gyrus. The Sylvian fissure is also at the lateral aspect of the brain, but really inside the Sylvian fissure, and it has a forming. I will show this later with a short gyri and long gyri. The middle aspect of the brain is very consistent. If we take all of us will follow pretty much the system here. So the first structure that we want to look for is the corpus callosum. The corpus callosum is not really cortical surface, but it's really easy to see. It's a very white structure in the middle of the middle aspect of the brain. Overlying the corpus callosum, we have the cingulate gyrus. The cingulate gyrus continues posteriorly with this narrowing called the isthmus of the cingulate gyrus, and then continues with the para-hippocampal gyrus already at the inferior aspect of the brain. This is the cortical C of the limbic structures. Then we see how the cingulate gyrus continues with the gyrus rectus, really at the inferior aspect of the frontal lobe. Here is the gyrus rectus, and the gyrus rectus continues itself with the frontal, the superior frontal gyrus, without a clear separation between them. They just continue one with another one. So this all here is superior frontal gyrus. Between superior frontal gyrus and cingulate gyrus, we'll have the cingulate sulcus. If we follow posterior the cingulate sulcus, it ascends posteriorly and marks the posterior margin of the paracentral lobule. This is why this sulcus here is called the ascending marginal ramus of the cingulate sulcus, because it's the posterior margin of the paracentral lobule. And so what is the paracentral lobule? The paracentral lobule is the most medial aspect of the pre and the post central gyrus, but here seen at the middle aspect of the brain. It's called the paracentral lobule, paracentral lobule. Posterior to the paracentral lobule, we will have this quadrangular piece of brain that laterally is called the superior parietal lobule. But here, seen from the middle aspect, it has another name. It's called the precuneus. So the precuneus is the superior parietal lobule, but seen from this middle point of view. Posterior to the precuneus, we have a very deep and easy to see fissure of the brain. It's called the parieto-occipital fissure. It's a good name because it's divided anterior the parietal from the occipital posterior. So parieto-occipital fissure. Posterior to this fissure, we have the cuneus. Have this name because of this triangular appearance. It's called the cuneus. Okay, so the cuneus is this triangular appearance of this piece of bone of brain here. Inferior to the cuneus, we have the calcarine fissure. The calcarine fissure that harbors the primary vision cortical areas, not the sulcus itself, but what is superiorly and inferiorly to the calcarine fissure. Superior, we have the cuneus, as I said, and inferior, we have the lingual gyrus. I like this old name, lingual gyrus, because it resembles a tongue. It resembles something that's goes posterior, lingual gyrus. But some more, I would say, more recent work will call this gyrus as the temporal occipital medial gyrus. So medial occipital temporal gyrus. This is another name of the same gyrus, okay? But I like this old name, the lingual gyrus. If we see underneath the brain, we have the inferior aspect of the brain. We have first interhemispheric fissure. Lateral to the interhemispheric fissure, we have the gyrus rectus as well. So the gyrus rectus can be seen on the medial surface, but also in the basal surface. Lateral to the gyrus rectus, we have the olfactory groove or the olfactory fissure, harboring the olfactory tract. And then laterally to this fissure, we have the orbital gyri. The orbital gyri is seen them subdivided by this H-shaped sulcus that is dividing the orbital gyri into one anterior, posterior, and lateral and medial orbital gyri. So we are going to look here for this H-shaped sulcus. So here we can see the H-shaped, but in some frontal orbital surface, we will not see the H shape. For example, here is the Y shape. but it's just to stress this concept that we want to look for these 4 different orbital gyri. This is one anterior, another one posterior, a lateral, and a medial orbital gyri. Then at the temporal, occipital, basal region, we will look for these 3 arrangements coming from anteriorly to posteriorly. The most lateral arrangement is made by the inferior temporal gyrus continuing with the occipital, with the inferior occipital gyrus. They just continues itself one with the another one. There's not a clear subdivision between themselves. But if we take the preoccipital notch, we will see this division. So anterior to the preoccipital notch, we'll call inferior temporal gyrus. Posterior to the preoccipital notch, we'll call inferior occipital gyrus. But it's really indeed the same piece of brain continuing between themselves. More at the midline, close to the midline, I already talked about this. This is the parahippocampal gyrus, and the parahippocampal gyrus will harbor inside the hippocampus, and that's why it's called the parahippocampal gyrus. The most anterior aspect of parahippocampal gyrus folds itself into this hook-shaped appearance, okay? This hook-shaped appearance receives the name of the uncus. So the uncus is the most anterior part of the parahippocampal gyrus that is folding into itself. It's folding backwards and having this shape of a hook, okay? This is why it's called the uncus. Between the lateral and the medial arrangement, we'll look for a gyrus, an intermediate gyrus, that I also like the old name. It's called the fusiform gyrus because it was in a fusiform, also an ellipse. So a fusiform between lateral and medial gyri. The most recent name is called the lateral occipital temporal gyrus. So both names are accepted. Medial and lateral occipital temporal gyri, or lingual and fusiform gyri, okay? And I just want to end my lecture showing the arrangement of the insula. The Turkish people is very proud of having Dr. Ture and Dr. Yashagil, and they came up with this very elegant paper, a little bit old paper, but still very, very recent. About 25 years ago, they came up with this paper, and they put the names of all these insular structures. So anteriorly, we have an anterior compartment made by short insular gyri that is converging into an apex, and posteriorly, we have long insular gyri that will not meet the apex. They will continue more to this part of the insula here called the Limbic insula. And between the anterior and posterior compartments, we have the central sulcus of the insula. I just wanted to show a picture of this and a picture with during my fellowship with Professor Rotten. Always nice to have mentors, to have people that inspired us. And this is when I finished my fellowship with Dr. Rotten about 12 years ago, with, of course, friends here and Dr. Rotten, as you guys know. Here is my email if anybody wants to get in touch with me. Here in Brazil, I work at these 2 institutions, at the left, the University of São Paulo, and at the right, the Albert Einstein Hospital, very known places here in Brazil. If everybody wants to visit us sometime, please send us an email. And thank you, Dr. Nagiza and Dr. Abuzer, for having me here. It's an honor.
Thank you, boss, for this great lecture. And I'm Naki. I will give a lecture about surgical neuroanatomy next week. I will copy your lecture.
I'm honored to teach you something.